Hi, Morton. I'm Tom's brother, John. Nice to finally meet you and get together with you. Sorry it's taken so long. I'm kind of a busy man. I appreciate the videos that you've sent to Tom. It's given me a better understanding of what you're going through. First and foremost, I'm sorry you have to experience that, and I know it's a little debilitating and aggravating for you as a cyclist, let alone how it messes up in your personal life and your routine. Based on what you've shown me, the area, Morton, it looks like the pectineus muscle may have been affected. This is a card that shows where the pectineus is. It originates up here, what's called the ramus, and it attaches down here on the pectineal line of the femur. Its responsibility is to, look at the leg please, is to medially rotate, okay, and help flex the hip, just as a cyclist does, okay. Tom explains to me that your leg is laterally rotated a lot. That's the way you stand, that's the way you sit, etc. This constant abuse, especially if you're cycling in this manner, you know, when you're cycling and you're bringing your leg out, is overworking and possibly stressing this pectineus muscle, which I'm going to show you where it is on top. If you want to come, can you see it okay? Come closer. Okay, if you open up the leg here and you put your hand right here on the softer part of the groin, okay? Turn your fingers down, and usually it is in someone who wears a short brief. It's right at that brief line, and you just push in. And if you would have seen Tom's face, you would have laughed because he grimaced a lot. And as a cyclist, his pectineus is tight, okay? We're going to work this muscle, and then I'm going to show you what other muscle is affected, and that is called the quadratus femoris, which is a posterior muscle, which is the antagonist to the agonist. Okay, the agonist is the muscle of action, the antagonist is the muscle of opposition. We have to work both muscles in succession so that you get better flexibility and range of motion, and you hopefully can correct this issue. Okay. First thing is, after we palpate, is we want to make sure I have the muscle. So Tom, if you would do me a favor and medially rotate your leg and bring your knee up into my hand. Do you feel that muscle tense underneath? So This tells me that I have the pectineus. Okay? So a common misconception about cyclists is that they think they have to like pedal way out here to get this full motion. Okay, when in fact you should be going in the opposite direction and pulling this knee in and coming around in a slight lesser big circle as your ankle flexes. Okay, is that correct? Right. Now this is probably going to affect things like your IT band, which is on the side of the leg over here, and then there's that muscle in the back, this quadratus femoris, and we'll talk about that in a couple of minutes. The most popular stretch in the world that everybody does is the figure four, okay? And that is nothing more than bringing this up here, propping on top of your knee, okay, and relaxing, okay? Morton, I don't know if you know about the correct stretch routine. Does he? Does he know 2 seconds?
I don't know.
Okay,
Probably not.
So a couple of these stretch gurus by the name of Jim and Phil Wharton developed a stretch routine, and it's called a 2-minute stretch. 2-second stretch. Okay, we're customarily used to doing 30-second stretches, when in fact that's actually doing more damage than good. At 2 seconds, the communication between the tendon and the muscle stops, and the muscle actually starts to separate, and then you get some tearing, which is commonly known as tendinosis, and then you get inflammation, which ends up being tendinitis. And that is possibly what you have here in this pectineus, is some form of a tendinitis, okay, because it's inflamed. The basic stretch for this is to, if you can do this sitting up, you can do it laying down. The best is laying down because your body's in a rested state and it's elongated. Okay, and all the stretch has to do is just push gently down on that knee, 1,000, 2, 1,000, and relax. And more, when you relax, you bring your leg all the way up and you relax that muscle. If you don't give that muscle a chance to contract, is going to spasm, and you're going to know that really quick. Okay? And you come up here.
So he can't put any pressure on it laying down, so should he stand up and push down on it?
He could, if you want to, if you want to come up a little bit, just like this, and Tom, if you want to, push down on the outside of that knee. And can you feel that in that pectineus?
Yeah, but I'm not feeling a lot of stretch on it.
Right, okay.
That's better.
Okay.
Like
see
that.
see Morton, how he's using the same arm? So if it's on your right leg to where you pointed, use your right arm to put down. If you have assistance,
And then just let it up.
and just let it out and relax. Okay.
And I can
And
feel
it's
that.
not necessarily quality as it is quantity. 1,000, 2, 1,000, and relax. Okay. And Tom will tell you he's about ready to go on a ride, and he's going to have a lot better production out of his thigh and
Okay.
pelvic region, okay? The other one is a more advanced version of this, okay? And we need some form of a wedge, so I'm just going to use the bottom end of this linen, and I want you to rock it this way and get that up underneath that hip, okay? Now the hip is
I can feel that
pushed
already.
up. And just by your leg being in this position, it's pulling on this pectineus. Okay? Because the action of that medial rotation and of the hip softens that. Okay? And then down. And you can just 1,000, 2, 1,000, and release. Morton, you got to remember to just go till you feel it. Don't push into it or anything like that, because then you start tearing things.
All right, let's try doing that sitting up just a little bit.
Just a little bit.
Oh, I can feel that.
Okay.
In there, sure.
Yes. Okay.
And then rotate it back,
And rotate
loosen
it
it
in.
up,
Yep.
cross it, push it down. And I can feel that right in there.
And it's so isolation issue. We have to isolate the muscle. You've got so many. You've got the gracilis that comes in here. You've got the vastus medialis that comes up. This lateralis. The major muscles of the quads get involved. The pectineus is a deep muscle. Okay, so deep muscles are meant to be stabilizer muscles, not power muscles. So if you don't have the correct form while you're cycling, that is not doing any support to the pelvic girdle, and the smaller muscle that's trying to take the brunt of it so the bigger muscles can provide more power are failing. And then this tightens up, and then you get off the bike and you're done. Okay? There is another stretch that will incorporate more muscle groups. Tom, if you could scoot over to the edge of the table, my side please, just a little bit. Okay? And all I want you to do is just drop this off. Scoot back just a little too far. Right there. Okay? Right here. And you can do this with a rope belt. Okay? Hold on a second. So you don't need assistance. Okay? A rope belt is soft, and you can do what you want with it. Okay? I suggest you put it in half like this, and then pick this leg up so you can see. You come around your ankle, slide it through. I did it backwards. And you just have to play with that until you can get it done the right way. Nope. Anyway, I want you to come around the bottom of your foot like this, drop it off the edge of the table, and grab this with your hand. Can you walk around the side, please? So you can see this stretch? Okay? You got to relax, Tom. Okay.
I'm trying.
And gently pull back on that. Now you should feel this all the way through that inner thigh, those adductors. Do you feel that?
Yeah.
And the farther, that's all right, the farther you go out and away from the plane, the more it accentuates that stretch, okay? And it's 1,000, 2, 1,000. If you want to really anchor that down, you can put like a semi-slip knot in that. There. So now he can pull on that. Okay? And Tom can tell you, can feel that stretch, 1,000, 2, 1,000, and relax. Relax it all the way down. Okay, 1,000. Now, with somebody around you to help, if you have somebody to help you, it goes a lot easier because that person can hook their leg right here like this and just lean. 1,000, 2,000. 1,000, 2,000. You have to remember, it's not so much quality as it is quantity. Okay, the more you
That's a
do,
good one right there. Pull
when
it
you
out a
go
little
more
bit.
lateral, it really isolates this whole inner thigh. And for cyclists, your adductors being lengthened are unbelievably important. Okay.
Now, is that similar to when I do this stretch?
Yes, it is. Yeah, because you can feel that.
Right.
Okay. So the next one. Uh-oh, I buried it. Is a quadratus femoris, and it's a posterior muscle, and this is a posterior view
The back.
on the back. Okay, it originates on the side of the ramus and inserts over here on the greater trochanter of the femur, which is, for Tom, if you would turn over
All the way.
all the way. If you visualize this and Tom, okay? Here's the bottom of that ischial tuberosity in the ramus through here, and then the greater trochanter is over here, okay? This muscle is very short and dense, and it has to be because its function is to laterally rotate, just as in he's doing there, okay? Or I can tell you by this, lateral movement of that hip. You see it okay? Okay? So, you know, you can self-massage that with a ball, and just a little side note, if you take a tennis ball and you put it in the freezer and you let it get frozen, it makes a perfect roller in that gluteal region down through here. You can use the wall and roll that around or on a floor, and that ice is getting into there very, very well. Okay? Okay, so we got some self-massage going on in here. All right? Here is a very good stretch that to affect that. Get this out to the side, so that muscle is now shortened. Okay? And if you can see, the leg is rotated this way because that femur sits right here like this, and this little bitty muscle comes from here to here. And as I rotate this in, this rotates it inward and it lets that muscle relax. Okay, so in this position here, and then keeping that rotated outward, you go here. Tom, do you feel that in this isolated area?
Mm-hmm.
Here, okay? 1,000, 2,000, and relax.
All right. How can he do that himself?
I will show you.
All right.
Good question. The same thing.
Explain the importance of stretching that muscle to take the pressure off the other one.
Okay, this is the antagonist. This is the muscle of opposition. When you are flexing that pectineus this way, you're lengthening the quadratus femoris. Okay, so in order for them to work in unison, so this is this muscle is probably very, very tight on you, Morton, and very, very short. So you need to lengthen this. So this pectineus can contract itself into a relaxed state. Does that make sense?
Yes.
Okay. So you
It's
hook
that
this
tug of
up.
war. I explained that tug of war to him.
Okay. So if you hook this up here like this, and you reach back with your hand, and all you have to do is just pull down 1,000, 2,000, and you just straighten out your arm, and that's enough. Okay. And then pull again, 1,000, 2,000, and Tom can tell you that he can feel that, correct?
Yep.
And it's isolating in that area, correct?
Yep.
Okay. And relax.
Then you can kind of move
And
it around a little bit.
always
to
go
feel.
in different planes. Don't just stay in this plane here. Bring it up over here. Bring it up down here. So it's affecting everything in this region.
I can feel that on the inside too.
Yes, on the adductors here?
Yeah.
Good. Now, the other side, the other way of this is to get the other side, the outside. So Tom's going to reach down with his left hand and grab a hold of this rope, and he's just going to give it a nice gentle pull there, which is opening up the flexors on the lateral border, correct?
Right.
And it helps this IT band. Okay. One of the biggest things I find with cyclists is that their IT bands are like concrete. Okay, because it's an overuse issue, repetitive use. Okay, and advanced stretch for this, and this is when you have somebody to help you. Get that knee propped up, you push down here, and you pull that up. Isolating, Tom?
Oh yeah.
And you pull down, you got to have pressure here at the top of the pelvis, somebody to help you, and you come here. 1,000, 2, 1,000, and you can just let that relax. Okay? 1,000, 2, 1,000, and relax. So always remember, Morton, it's not so much quality as it is quantity.
Okay, let's make sure we show them the the standing IT and also that
The what?
the stretch so we can stand and do them.
Okay. Tom, if you want to come up. The object to this, Morton, is to affect this whole side of this leg here, okay? From here. That IT band is a part of the gluteus maximus. So the glute attaches way up here along the iliac crest and down the medial border of the pelvis.
Wait. Okay.
Oh, the light in the way? Well, then you move over. Okay?
Yeah, that's better.
Okay, so this all becomes one. This is the IT bit. This is the glute maximus, turns into the tensor fascia lata, is what hands in pockets like this, and then turns into the IT band, and all the way down here. Now, Morton, I can guarantee you push on this spot right here south of your knee, that little bony landmark right there, and it's probably going to be tender. Okay, so a perfect stretch for this is if you want to cross the affected leg over the front. Okay, and then you take that toe and you point it away from you. You see how this is pointed down here? And then you get some balance and you bend over reaching for that other toe. And see, he can't even do that. And that's a good stretch for him. And go until you feel it. Don't push it. If that's as far as you can get today, that's fine. But remember, it's a 2-second count. So Tom, if you would go through this with me. 1, 1,000, 2, 1,000, and relax. Again. 1, 1,000, 2, 1,000, and relax. And 1, 1,000, 2, 1,000, and relax. The farther you point that toe this way, the more it isolates that stretch all the way through here, okay? And it's all the way through the hamstrings. It affects this whole leg muscle. And Morton, that's what you really need to do, buddy, to get that loosened up, okay? Does he have a massage therapist?
No.
Where does he live?
Denmark. All right, now what are you going to do?
That's pretty much it to affect that muscle rupes. I also want to recommend that you use ice, okay? On the affected area, especially. The worst first is what we always do, because that's the body's recognizes that first, that area first, and then goes from there. So if you put ice in this
can
area,
you do that tennis ball thing or
you
what?
can use a tennis ball. Yep. But if you want to just isolate with an ice pack right here and compressed in there for 20 minutes, and then as soon as that 20 minutes done, you immediately go to heat for 20 minutes, and then go back to ice for 20 minutes. It's contrast therapy, ice, heat, ice for an hour. That's all that takes. And that's one of the things that you can do pre and post. So before a training run, just give yourself enough time for your body to reacclimate before you go out there and hammer on the bike. Okay?
All right, now let's go through all the stretches one more time quickly. Right?
Okay. All
So
right.
on the back.
On the back. Okay.
Do this one. Right.
On the back for this one, you have to be up on your knee. Okay. And if that's uncomfortable, put a pillow or a towel in there. Okay. And you push down. Okay. And you do that, I don't know, 10, 20 times. Okay. And if you have something to put up underneath you, a small pillow or something, okay, just up underneath that right cheek, and then that really isolates that area, okay? And then you will turn over. Oh wait, no, one more. And that's the one where you drop your leg off the side, and you can just act
Use
like
a belt.
with a belt, and you can pull
That back.
and relax, and the front, and stay away from the plane of the body out here, okay?
You can really feel that in there.
Really feel that in there. Now we'll really open that area up, Morton. Okay, so if you have somebody helping you, they can do this. If not, act like you got that little belt in your hand,
Right.
and you just pull, release, pull, release. Okay, If you ever feel discomfort through that stretch in any other wear area like the knee, stop. Okay. The other one is prone on your back. You bring this leg all the way up to the edge so it's away from you. Bend that knee. Okay. And act like you have it. You remember you got to turn that foot outward, and then you pull. 1,000, 2, 1,000.
So I can actually reach that and do that, and I can feel
You
that.
couldn't do that before, could you?
Right. And
Just
just
that-
that standing stretch loosened that up
That's
on
right.
me.
Okay? You got to keep that foot up, because if you turn this foot in, you're really not doing anything but working the inside of the thigh here. You really want to isolate that muscle right up in here. It's a short muscle from here to here. Okay? And then the other one is that standing stretch that we just showed you. Okay?
Right, which we'll do that one more
Do
time.
it one more time.
Because we've got like a routine going here.
Right?
So we stand,
Yep. Cross the
We
affected
cross,
leg.
we
Yep.
turn our
No,
foot. and then we turn and reach like that.
And 2-second hold.
And we relax it. Loosen up that hip. And then do it again.
Right. Now, Tom, tell them the difference you feel between right leg, left leg.
Well, yeah, I can feel it already because I would hate to have to try to now do this one because that one's tight. But we all ought to be doing those, really.
Right.
You know,
No,
because
we should.
I've had this same issues with these muscles all in here. It's because when we're cycling, gravity wants to pull our legs apart.
Right.
On recumbent bikes, regular bikes don't have this problem because they're straight up and down. But we have to use it when we're pedaling, and our knees are not stable.
Right.
And it's jerking that muscle
That's what happens.
as you pedal.
Yeah, and so the comfort part of that is to just go on the outside.
Right, you just let your leg fall out,
Right.
but now this shortens up,
Right.
and then this gets all pissed off.
Right. And it actually gets over lengthened where it can't contract.
Right.
Morton, you also have to remember you need enough calcium and magnesium in your diet. Without enough calcium in your diet, energy or ATP won't absorb that calcium and will not allow that contraction to release, and then you have damage. Okay? We can go into that further